Okay, so now that we have talked about what the microbiome is, what lives there, and what can go wrong with the microbiome and the disorders that it can cause, we're now going to move on to lesson 3, which is diagnosing your gut. And in this lesson, we're going to talk about the different forms of testing and the process that is used to decide what kind of tests are applicable and what we do with the results. So when a patient or client comes to seek help for a gut disorder, we first like to define what the symptoms are, what kind of clues are we looking for in order to say that the gut is implied in this imbalance. So as we've discussed, there's many different symptoms that can be seemingly appearing all over the place, but it all goes back to the gut. So these can be multiple systems, which is going to give you a variable picture of what this patient looks like. So the patient may come in with the obvious gastrointestinal symptoms of digestive dysfunction, such as diarrhea, gas, bloating, constipation, but they may also have other more non-specific or not gut-related symptoms, such as brain fog, irritability, headaches, mood swings, anxiety and depression, joint pain, weight gain or inability to lose weight, or skin problems such as acne or eczema. So an astute provider will look at all of these things and suspect that the gut is implicated. But if you take these things individually, it might not give you to the right conclusion. So my answer to this is test, don't guess. So we can do a lot of speculation and treat empirically, but a lot of times that's not a good idea. I like to be able to test and get definitive answers instead of guessing and maybe being wrong. So it's always better to get a concrete answer through testing. And when we test the microbiome, we are making the assumption that, the gut is at the center of the body's health and wellness. And that's been talked about very recently in the literature. It's all over the place. And the thinking is more and more that the gut is important to determine and unravel anybody's symptoms. So testing the gut makes sense as the first step to figure out what's going on. So we can either stop there and treat if we found some abnormalities, or we can do further testing based on the initial results and the symptoms of the patient. So I'm going to go through mostly gut testing, but we may discuss a couple of other tests that that are not directly gut related, but can be related to levels of inflammation or hormone health. So I'm just going to use the example of when I see my own clients. I meet them via telehealth. I get a basic history of what's going on. So it's just as simple as asking a client to just outline what's been happening recently. What are your symptoms? How long have you felt those symptoms, and how often? When do you feel your symptoms? Do you feel them all the time? Do you feel them after meals? Do you feel them when your stomach is empty? Do you feel it when you wake up in the morning, or when you go to bed at night? And you want to get a picture of their stress level. What environmental factors, what else is going on in their lives? Do they work all the time? Are they a busy, busy career-driven person with a very active family, and they're responsible for a lot of different things? So what is their stress level? What medications they're taking? Often you can find out a really good idea about somebody's life and what their pressures are by what medications they're taking. Are they taking a lot of supplements? Are they not taking supplements? So when you talk about medications, you're talking about prescription medications and non-prescription medications. It's always a good idea to ask. And if you're ever asked by a provider, what are you taking? Be sure to include not only prescription medications, but also the non-prescription varieties as well. That includes supplements. And then finally, you want to ask the client, well, what are your goals? Are you looking to lose weight? Are you looking to maintain your weight? Are you looking to stabilize your mood? Are you having issues that are just system related, just GI related? So you want to determine what their goals are and how you can best help them. It's always a good idea to have a comprehensive medical history, and the typical history that functional medicine providers do, as opposed to allopathic providers, is usually very wide ranging. It goes back all the way to childhood and up to the present day. You always want to get patients' contact information, so obviously name, date of birth, address, phone number, etc. You always want to know what is immediately going on, what's the current problem, how long it's been going on. Again, medication is very important, including non-prescription medication. You also want to get a history of any testing that they've done. I want to know, have they had when was your last colonoscopy? Or have you had any radiologic exams? Have you had a chest x-ray? Have you had a CAT scan? What for? It's just a lot of questions, and you can get a lot of information just by the tests that patients have had. Have you had recent blood work done? What did it show? Can I see a copy of it? All these questions. You want to get a history of cancer, other illnesses, what family history they have, what's their birth history. Remember in lesson 1, we talked about the colonization of the microbiome starts when you're in utero. So what was their birth history? Were they a C-section birth? Were they a vaginal birth? You don't know. You need to know these things. Right? And then finally, you start talking about what environmental exposure someone has had. What is their diet? What do they eat on a regular basis? Do they keep a food diary? How attentive are they to their nutrition? Again, you might even insert supplements here and say, are you taking any supplements to supplement your nutrition? Do you take any probiotics? What are your environmental exposures? Is there smoke in the house? Do you have any exposures to pesticides, cleaning products, any other chemicals in your environment, and also dental history, because remember, health begins in the mouth. If someone has poor dentition or neglected gums or periodontal disease, that tells you a lot about their general state of health. And then finally, psychosocial, meaning, what is their mood? Do they have depression? Do they have anxiety? Do they have any addictions? Are they being treated for addictions? Are they being seen by a therapist? You don't need to know the particulars of therapy, but it's a good idea to know how attentive the patient is to what their overall well-being is and what their struggles are. You're getting to know a whole person, and it's I think it's very important to know someone from all aspects, and that includes their psychosocial aspects. So you want to be able to allow a client to take time to think about everything in this picture, and in this context, you're going to realize that I use patient and client kind of almost interchangeably. It's not really that's just the way that is. So, you can take it however you want. If you want to be a client, fine. If you want to be a patient, that's fine. Actually, if I'm thinking about it, I usually call people clients now, because it's a perspective of I want from wellness rather than from sickness. So I will try and refer to clients as clients, right? So after I get an intake and all the history that I outlined in the last slide, I go over this form. It's basically a big form, and I go over it myself. So that I want to get a picture of this client. I want to see where there's more information. Do I need more information someplace? Do I have any other questions? And then I start formulating a differential, which means the kinds of things that I think might be going on. And it can be a list. Sometimes it's a list in order of most likely to least likely. This is a good thing to have this is what I have in my mind when I go and I speak with the client. I'll go over the history. I ask more questions where I think is necessary, and then I'll discuss different options for testing for the client, depending on what they're interested in. And we agree on where we're going to start. And what's very important is that I don't ask clients to discontinue any prescription medications. I think that, if you've been prescribed something by your doctor, then such as a blood pressure medication or anything for, anything else you can imagine. If you're on a prescription medication, I do not ask you to discontinue that. That's just I don't interfere with other physicians' treatments. However, I will raise my eyebrows at PPIs. That's kind of a thing that I have because it directly affects the GI tract, and I've found clients being on PPIs for 20 or 30 years. And the truth is that you're only supposed to be on PPIs for maybe 4 to 6 weeks. So you do the math. Once the client and I have agreed on what we're going to look at, I'll order the test. And then the client will receive an email that the test has been ordered. The client will pay for the test. I usually don't include the fee. I usually do not, I usually don't collect a fee for the patient for the test because there are some tests that they take Medicare or other insurance or an HSA or flex spend. So I let the client settle that with the testing laboratory. The test is shipped to the client. The client receives the test kit and gets the sample, whether it's stool, urine, or blood. Those are the 3 things that are usually asked for in a specimen. And then the completed test is sent back to the laboratory. Once the laboratory receives the specimen, I only use laboratories that are permitted, meaning that they have permission from CLIA and the state. CLIA is the federal government. CLIA stands for Clinical Laboratory Improvement Act, and that is the standard and of practice for laboratories in this country, and they've met the appropriate regulatory requirements for performing the test. And these are laboratories that get inspected by the federal government on a regular basis. Once the results are ready, after the test is processed, the results report is produced and delivered to me by the laboratory. Sometimes I will meet with people in the lab to go over the test results. Usually these results come in many pages. They are comprehensive tests, and we kind of come to some sort of conclusion and possible options for interpretation, because I can provide the clinical picture of the client that matches with the test results. And we work to figure out what's going on and what may make the client feel better. Then I meet with the client to go over the results. So first thing I do is I ask the client if there's any new information, and I see how they're feeling. I will make recommendations based mostly on nutritional and lifestyle changes. If, however, a client has H. pylori infection, remember that from the last lesson, or other dysbiosis, we can work with supplements or nutraceuticals. Usually it's probiotics, or if it's H. pylori, I will ask a patient to take maybe oil of oregano for a period of time, or marshmallow. These things are safe and effective for these kinds of infections. I don't prescribe antibiotics in any situation, because it's been shown that antibiotics can actually further exacerbate a dysbiosis. And then also, if there's something that's in the test that raises a red flag that patients need to be worked up medically, meaning if the client needs a colonoscopy or an endoscopy for some reason, for something in the test to indicate that, I refer them to a GI doctor so that they can get the care that they need. So now moving on to the kinds of tests that we do that I often recommend. And the first one, first and foremost, is stool testing. Stool samples are tested using a methodology called quantitative PCR to assess the overall health and functioning of the microbiome. And by quantitative, I mean it's how many organisms. So we look at levels of bacteria, including commensal and opportunistic. We look at yeast, viruses, parasites, pathogenic bacteria such as H. pylori, Campylobacter, and C. difficile, as well as markers of digestion, absorption, and inflammation. So this is really first-line testing for gut health, and any functional medicine provider will tell you that one of the first things they do, one of the first tests that they'll order is a test for stool to assess the microbiome. You can also do mucosal barrier testing, which is a way to differentiate the levels of gut dysfunction from simple sensitivity to inflammation to more extreme levels of leaky gut. So these are measures of IgG and IgA for the gatekeeper markers. So we want to see that the mucosal barrier is intact, that it's not leaky, that there's nothing that's not supposed to be getting through. And this also can be tacked on in the case where you're doing a food allergy or food sensitivity testing panel. You can do that as an add-on, and that's very convenient because sometimes you may suspect a food allergy or a food sensitivity. Food sensitivity testing can usually test blood spot or serum. So it's either through phlebotomy or through a finger stick on a blotter paper. It's looking for IgG antibodies. And remember, the IgG is the most predominant form of immunoglobulin in the body. So you will want to assess the IgG antibodies for different foods. And most panels will have like hundreds of foods that are included on their panel. So everything you could possibly imagine. And it's very helpful and convenient. So if food allergies or food sensitivity is suspected, it's usually a blood spot or a serum test. Now, if you're looking for celiac or gluten sensitivity, That's also a serum test. You're looking also for not only the antibodies, but the genetic markers to help you diagnose celiac disease and non-celiac gluten sensitivities. And those genetic markers are the HLA markers. It's HLA-DQ2 and HLA-DQ8. And the antibodies you're looking for are also they're a mixture of IgA and IgG antibodies usually for gliadin and other antibodies that can be suspected. So organic acid testing, or OAT test, is a urine test that gets a picture of the nutrient status and the overall health metabolically of the patient. It looks at metabolites of organic that are represented as organic acids in the urine, and they can detect over 76 markers. So you can detect intestinal yeast and bacteria, vitamin and mineral levels, markers of oxidative stress, neurotransmitters, and oxalates. So with the organic acid test, you may want to test patients who have presenting symptoms that involve mood disorders, or you're suspecting mitochondrial dysfunction, if they have fatigue, chronic stress, inflammation. All non-specific. I know they're not really anything specific. So you just generally want to get an idea of what their overall metabolic health is. And there are specific diseases that are associated with increased organic levels include diabetes, cardiovascular disease, depression, anorexia, anxiety, neurocognitive decline, and some cancers. So SIBO, which is small intestinal bacterial overgrowth, occurs when an abnormal increase in the overall bacterial population occurs in the small intestine. So these are usually bacteria that are not commonly found in that part of the digestive tract. So for some reason, these bacteria migrate or get into the small intestine, either because the patient has an upper GI disorder, such as a hypochlorhydria, or has H. pylori infection. And so these bacteria, instead of being taken care of normally by the gut, are migrating down in and overgrowing in the small intestine. So SIBO occurs sometimes when there's surgery or disease, which slows down the passage of food and waste products in the digestive tract, which favors the growth of certain bacteria. The SIBO test is a breath test, so it's not blood or stool or urine, it's breath. There's a 3-hour test which measures hydrogen and methane levels on 8 breaths that are collected in tubes after consuming a lactulose solution. And these tubes are then shipped to the lab, and the results are rendered. And one thing that you should know is that you need to fast for 12 hours before taking the test, and do not take any probiotics 24 hours before the test. So there's very specific instructions, because food and probiotics affect the breath and will skew the test results. The Dutch test is the only test on here that is not directly a gut test. The Dutch test I've included in here because sometimes we will use it to look at what the conditions of someone's hormones are. It looks at sex and adrenal hormones and their metabolites. And it also looks at cortisol patterns, as well as organic acids and melatonin. So it looks at really the metabolic health of the patient. So it's kind of like an organic acids test, but it's more in line with looking at the hormonal status, and it gives you a little more information about what their cortisol pattern looks like. And this is a dried urine test. You have to take multiple samples. You have urine on blotter paper, and it's dried, and so you send all these little pieces of blotter paper back to the laboratory, and they look to see what the free cortisol is, the hormones, the hormone precursors and metabolites. And so it can give you a lot of information, and we use this commonly in conjunction with doing a gut health test to get, again, an overall picture of the patient. So that's the testing component. And once again, I will say the following disclaimer, which is that the course is for educational purposes only, and it's not a substitute for medical advice. And if you have concerns for your health or wish to be evaluated for any of these issues outlined in the course, please contact a healthcare professional. And if you're interested in testing, these tests usually need to be ordered by a qualified provider, such as myself. And if you're interested in testing, or you're learning more, you want to learn more from me, but just feel free to reach out at my website, intentionalselfct.com. Facebook page is Intentional Self, and my Instagram is Dr. Terry Alacio. So that's it for lesson 3, and I'll see you in the next module. Thank you. Bye.